the AAVMC and the APLU, and just want to give an overview of what they've been up to. They formed a task force on antibiotic resistance in production agriculture, and really that all started after the 2014 PCAST report, which Lonnie King, the co-chair of our task force, was a member of. And then that led to the National Action Plan, as we all know, which kind of aligns with the WHO's Global Action Plan for the broader antibiotic resistance initiatives, which obviously include animal agriculture. More specifically, looking at animal agriculture, we've seen California legislation, which was discussed by Larry earlier, and that actually calls out the Department of Agriculture working with the Veterinary Board, the State Health Department, universities, and the cooperative extensions to develop antibiotic stewardship plans and best management practices. So there's clearly a role for the universities in these different initiatives. But looking at agriculture in general, the task force believes that we need to be equal partners with human health in this initiative. And so that's bringing together this whole One Health perspective that, I think Lonnie King was one of the biggest proponents for that at CDC, and he's really brought that to the task force as well. And one of the things we need to think about during all of these antibiotic resistance initiatives from the agriculture side is how do we make sure that we're still maintaining animal health and ensuring that we're able to continue enhancing production to feed this growing global population. And a little bit more about our organizations. The Association of American Veterinary Medical Colleges is 49 different institutions, international as well, and then 23 affiliate members that are non-accredited, but most of those are international schools. APLU is a little larger, 237 public research universities, land grants, and that includes the cooperative extension. And they do $41 billion in research annually. Looking at the membership of the task force, we pulled from our agriculture and veterinary colleges and then brought in members from the different commodities and then also some representation from the pharmaceutical industry and the federal agencies because we really wanted to get together and find some shared priorities. And so they came together and created 3 broad categories of recommendations where they found commonality. The first one is education. And this kind of came up earlier in our group session, actually, that, there's veterinary training on antibiotic resistance, but what about the producers? What about the general public? How are we addressing, how antibiotic resistance is taught to different groups of people? So one of the first things we're doing is getting together a working group to put together some core competencies of what different programs should be learning about antibiotic resistance so that different programs can look at what they're teaching and compare it to what our group has come up with as recommendations. But we also need to address practitioners, which everyone here has been talking about, FDA, USDA, and the universities offer another outlet of reaching those practitioners. And Larry brought up the National Veterinary Accreditation Program, which we also stand ready to assist with updating or expanding. Moving into outreach, I think I've heard from most groups here that there's a concerted effort to, make sure that producers are not getting blindsided by upcoming changes to the VFD and anything we can do to continue to increase that outreach. We're looking forward to partnering with others on that. We think the cooperative extension service is a great bridge to reach producers as well as veterinarians out in the field. They're conducting CE all the time and a great avenue to explore. One thing we haven't really hit on is that next generation of people that are going to be using antibiotics or prescribing them. So we're looking at how can we tap into those groups like 4-H and FFA and other kind of STEM groups that are out there looking at different agriculture issues, and this could be one to explore with them. As we all know, there's subway announcements and the confusion around that or the lack of clarity, and when we respond to those issues, our messages mean a lot more when we're able to have joint messages between animal and human health. If we can find any common ground, for example, talking about both human and animal health groups, believe that there are times where there need to be antibiotics given to animals. while we may differ on areas around that one point, having that clear message for consumers and the public to know that there is agreement on that at least, I think is an important part of this discussion that kind of gets couched in larger message around that subway announcement. As the universities, we feel that we have kind of an objective voice that can serve in that role as well. The third kind of broad category of recommendations from the APLU and the AAVMC task force looked at research principles. They really feel that there's a need to have interdisciplinary teams. Right now, you can look at a lot of antibiotic resistance work, and it's either ag or it's human health or it's consumer interest groups. We really need to find a way to do some projects where we're linking up together and exploring these issues. And private sector has to be a part of this from the beginning, and this really all needs to be in a One Health approach. But we also need to be looking at both basic and applied research. There's a lot to do on both sides. First of all, looking at that basic research side, there's a lot we don't know about these bugs. The transfer of resistance between species through the environment, as we heard the other day in the presentations with wastewater treatment, plenty of unknowns there that we need to be exploring on the basic research side. Looking at co-selection of resistance genes is one of the priorities for the task force. Also, the role of the a host immune system and how that impacts or whether or not resistance develops during an infection is important to better understand, because we don't fully understand that. And then the whole field of metagenomics, there's a lot that we can do there. Looking at alternatives, it's important that we're looking for alternatives, whether they're new products or better evaluating the alternative products that we already have, the efficacy of existing alternatives. And when we're talking about even just diagnostics, there's this pipeline problem, especially on the animal health side, that we really need to resolve. But we also, as the task force, support developing the pipeline on the human side because we think that offers advantages for the animal side as well. Moving on to applied research, there's really a need to develop computational methods and tools for the metagenomic analysis side of things. Also, better models for risk assessment. And like I said, diagnostic capabilities. We just had a whole, our group was focused on diagnostic capabilities, and there's big discrepancies between the human and animal health side. And there's been a lot of a push for diagnostics on the human health side because of the different, structure of hospitals and things like that. But we need to find some way to get better diagnostics, or if not, find out the reasons why and see if there's ways that we can address those through policy or other means. Looking more at the resistance piece, we're talking about what are the drivers across different sectors. We've heard from, poultry, swine, and beef, and they're all different sectors. But we, try and address this as animal health issue. We need to understand the different drivers between each and how we can try and work together to address those in a collaborative nature. That involves looking at the best practices, looking maybe at the California legislation, for example. It tells you to develop antibiotic stewardship principles and best practices, but it doesn't say for each species or anything like that. But there's going to be no one-size-fits-all approach. So we're going to have to all work together to find out, building on the work that's been done by the producer groups or the, specialty veterinary groups, whether it's AAVP or, NCBA. How do we build on all of that work that's been done and find what the right way to assess the best practices and stewardship guidelines are? I thought it was interesting when Dr. APLU was talking about, getting requests from practitioners to evaluate their stewardship guidelines, and that definitely seems like something that'd be worth investigating. How can we build on that? And Dr. APLU can't be at every practice across the country. We need to find a way to fix that problem. Then looking at guidances 209 and 213, we've talked a lot about the resistance issue. How do we assess resistance, or how do we assess whether there's a reduction in resistance? But there's also important questions from a policy standpoint of what are the economic impacts of these guidelines? Are they, causing excessive, are they overburdensome? or are there animal welfare issues that come up? We need to be constantly looking to make sure and safeguarding animal welfare and health when we implement these kind of policies. And ultimately, we're trying to see, whether the antibiotic resistance patterns in animals are leading to a risk in human health. We're still not there yet. Looking at next steps, the task force is acutely aware that we can put forth our recommendations, but we need to have a plan of action of how we're going to go about implementing those recommendations. And so the first part of that is what we're doing right now, meeting with all of y'all, engaging with stakeholders, meeting with agencies, getting the message out, and coordinating efforts. We brought together kind of a diverse group to define shared priorities, and now we have to continue that kind of coalition to advocate for those priorities. And that involves continuing meetings like NIAA. This is one meeting during the year. Let's plan for the next meeting. Those discussions are already in place, and hopefully be able to make some announcements soon. But we need to continue to advocate for the role of agriculture in implementing the U.S. National Action Plan. Part of that is congressional outreach. I know a lot of people in this room would rather not deal with Congress. Having worked there for a year, it's interesting. On the antibiotic issue, I heard from one side of this story. I heard one side of this story while working. It was from the Public Health and Consumer Interest Group. While I know that animal agriculture is very interested in this issue, it is not something that was ever brought up in any meetings with agriculture groups or animal health groups. It's just not a top priority during congressional visits. There's various reasons for that, but I think that with desire for funding from USDA and FDA, if we don't make our voices heard that we want these kind of programs to proceed, then they're not going to happen. And for a midterm or mid-range goal, the idea of university-based pilot projects. So just thinking about the different research recommendations, education programs, but also potentially building on the idea of these stewardship evaluations. And we think that these need to be ideally placed at universities that have human medical, veterinary medical facilities, as well as strong ag and environmental research programs. That way we can start from with students and researchers having this kind of One Health approach that we can make the case for to say that it can work. And ultimately we think that those could build to larger state level initiatives, and even a long-term goal of having a university research organization, which is basically a sustained multi-stakeholder initiative focused on antibiotic-resistant bacteria with an agriculture perspective involved in it, as opposed to just having more human-focused and consumer interest-focused initiatives that are currently out there. We think this would be a mechanism to coordinate and collaborate research and educational programs and really kind of bring that One Health approach to the next level, but that's going to require both private and public funding. And with that, I just want to thank you all for this time and give you my information in case you want to learn more about the report. I'm happy to send you the report and any kind of partnerships talking about these different programs where you might have research ideas. We've talked about there's different people in drug development, there's people in research, and all kinds of areas where we think the task force has a role in supporting those projects.